With the rise of the cases due to variants, would you recommend the use of ECLIA test to assess for viral load or antigen test for patients that are still RT-PCR positive? Dalawa po ito. Is RT-PCR still recommended to ensure that the patient is not infected anymore prior to return to work? Kasi may nakikita po kaming mga company na instead of the RT-PCR test, pinapakuha po yung ECLIA test kasi yung sa vaccine, and they would like to know kung nakataas na yung mga antibody titers po nila.
Okay, first I would like to comment yung infectiousness ng virus Sa ngayon kasi ang ginagamit na natin is the time base From the time na onset of illness, and then you count 14 days, mild to moderate. Then on the 14th day, talagang hindi na siya infectious. You don't need to repeat the RT-PCR. Remember, your RT-PCR will be positive up to 3 months, So, pag nag-positive ka, baka naman hindi mo siya papasukin ng 3 months, Sayang naman yun. Just have to observe. Kung wala naman siyang symptom, and then naka-recovered na siya, fully recovered na siya, can still go back, Can go back to work as long as na kompleto na niya yung 14-day isolation, Okay, now, I would like to comment on the antibody, neutralizing antibody, yung mga sinasabi natin na test, Kailangan yung tingnan kung ano yung antibody na dinidetect doon sa mga test kit na yan, There are 2 antibodies. One, the anti-nucleocapsid antibody and the anti-spike protein antibody. So, pag yung kit na yan contain the anti-nucleocapsid antibody, that means pag nag-positive ka niyan, you have exposure. So, ibig sabihin, that antibody means you have been previously exposed and you have recovered. Pag meron kang spike protein antibody, that's another story because it can be induced, or most likely it can be induced by vaccine. Okay? So, pwedeng nagpabakuna ka, you develop an antibody, that is the spike protein antibody. Ang tanong lang, kung nag-positive ka sa spike protein antibody, will that antibody tells you you are protected? No, because as of now, wala tayong level of antibody that will tell us na itong level na to, you can be protected, May mga pasyente tayo na nakunahan na, sabi nila, mataas yung anti-spike protein na antibody nila, pero still got COVID, So, dapat hindi tayo hihinto doon. Maski sasabihin mo pang meron kang spike protein antibody, magsusuot pa rin ng mask, mag-iingat pa rin. The other part there is the antigen test, The antigen test is a very good test, okay? And in fact, as long as your antigen test is FDA approved, what's the value of an antigen test now? The threshold of detection of antigen test is very low. You need a high viral load, okay? So, ibig sabihin, kung halimbawa, antigen test, gamitin nyo for screening, pag walang sintomas, mababa ang sensitivity, okay? But pag nag-positive ka na wala kang sintomas, most likely, you have the infection, okay? But we don't use it to screen sa mga workplace kasi kadalasan naman dyan wala mga sintomas So that will not add value. You'll just be spending a lot without adding a layer of protection getting the antigen test. Ang pinaka-importante pa rin sa mga company is really the health screening, Yung tatanungin mo sila, wala sila mga sintomas, you have to monitor them. Kaya napaka-importante ngayon na when you ask employees, dapat they should not deny, Kasi the only way na hinto natin ito is a lot of this will deny na meron silang sintomas tapos pumapasok pa rin, So you have to be very particular with that.